Hey everyone, I'm Dr. Jacobson, your go-to board-certified plastic surgeon right here in sunny Beverly Hills. Buckle up because in my practice, I've seen it all. From jaw-dropping transformations to some truly unforgettable procedures. It's been quite the journey and I can't wait to share it with you. Join me on the Beauty Blueprint, where we'll dive into cutting-edge procedures and techniques in the world of cosmetic plastic surgery and explore everything you need to know about the overall health and wellness. But that's not all. I've lined up some exciting guests who will share their insights on various aspects of health and beauty, making every single episode packed with valuable information and fun discussions. So grab your coffee and get ready to join the conversation every Sunday morning at 7:30 a.m. right here on Go Country 105. You won't want to miss a moment. Good morning, Go Country listeners. We're happy to have you back with us again this week. If you're a new listener to the Beauty Blueprint, welcome to the show. We air right here on Go Country 105 every Sunday at 7:30 a.m. I'm your host, Dr. Joshua Jacobson, your beauty architect, and I'm here with my co-host, Heather, who's also my patient coordinator. Everyone, please welcome Heather to the show.
Hey guys, I'm so happy to be here. Happy Sunday. It is a beautiful Sunday indeed. Today we're going to be discussing a very hot topic. This is one that I am so excited about because I get so many questions about this. Friends, family, patients. We're going to be talking about Ozempic and other semaglutide medications, things like GLP-1 indicators, just different variations of them on the market.
Yes, for sure. I think this is a very good topic because they've been out in the market now for a while, and a lot of people have been taking it. A lot of people are looking into it, and there's a lot of yes and no's. So I think this is a good topic to talk about.
Great. I can't wait to get into it. But before we do, Dr. Jacobson, are there any shows that you're currently watching? What are you into?
So I love crime shows. Right now I'm watching Castle. It's this detective and this writer that are just going about New York City solving crimes. And since I lived in New York City for a few years, it's kind of like deja vu for me.
I did not know that. Okay. I love New York City. Yep. Okay. So you're a true crime detective as well at heart, huh?
Yeah, totally. Yeah.
I love it.
Same question to you.
Oh my gosh. Okay. I as far as series, I have yet to get into Squid Games, but Squid Game 1 was so good. I was hooked. I could not turn it off.
Wow.
Have you seen it?
No, I haven't. I've heard all kinds of things about it.
Yeah, it's so good. I highly recommend it, and I have Squid Games 2 on my Netflix ready to go.
Oh,
yeah.
Cool. Awesome. All right, so let's get into it. Go for it.
Yeah, let's get started. Okay, so Dr. Jacobson, what is Ozempic?
So Ozempic is a medication that basically initially was created to treat diabetes. One of the ways that it would do was slow stomach emptying, and if your food is moving slower, then less sugar is getting to your blood, which means you don't have as high of a sugar. That was one of the effects. And the other one was it would stimulate insulin production. So, but then they realized that because of this slow moving of the food contents through your stomach, you end up being full longer and you get full quicker, and you lose a lot of weight. So then it started to become popular for weight loss, and especially since celebrities brought it to the public attention, it's taken off as a designer weight loss medication that's similar to Mounjaro. So Ozempic and Wegovy, they're basically the same medication, just different dosing. And then Mounjaro is a different medication, but similar properties, just much stronger.
I see. Yeah, that makes sense. Who is it really prescribed to? Like, who qualifies for it? What makes you a good candidate?
So the main use for them initially was diabetes, type 2 diabetes especially. But then nowadays they've also been approved for people who have morbid obesity, or they're very overweight or obese. So a lot of times the body mass index, BMI, over 30 or over 35. and especially if they have comorbidities, if they have other medical problems such as high cholesterol, high blood pressure, or if they've had a history of heart problems, and those have all been shown to improve with these medications such as Ozempic and Mounjaro, because what they do is they make you eat less, and also they cause these food contents to be released to your blood slower, which means less cholesterol is getting to your blood, less glucose is getting to your blood, which means all those problems that can be caused by these molecules such as glucose and fat, all those problems are going to be mitigated. So stroke, heart attack, diabetes, wound problems, all of those have improved significantly with these medications.
Are you ready to achieve the body you've always dreamed of? Look no further than board-certified plastic surgeon Dr. Joshua Jacobson. Dr. Joshua Jacobson offers a range of surgical procedures to help you look and feel your best. From breast augmentation to tummy tucks, our skilled team will work with you to create a personalized treatment plan designed to meet your individual needs and goals. Let us help you achieve the confidence and beauty you deserve. Don't wait. Contact us today at 424-465-3800. That's 424-465-3800.
Yeah, I actually had a friend who did that, and her blood pressure went down.
Yes.
And she was only taking it for cosmetic reasons, but she's like, I am so shocked. My doctor was shocked that my blood pressure went down, and she's like, I feel so much better.
Yes. Yes, because high blood pressure is also caused by obesity. That's one of the things that being overweight or obese causes. And by the same token, when you take one of these medications, as your obesity goes down, as your weight goes down, your blood pressure goes down, which is also very healthy, decreases your risk of heart attack, stroke, kidney problems, and similar problems.
Okay, very cool. Why do you think so many celebrities are getting on it?
So celebrities always want to try to look good on camera, and they don't always have the time to be always exercising and dieting. And from what I hear on TV sets, when they're filming, the food is really good. So I don't blame them for wanting to eat so much. But these medications have really helped them decrease their cravings, decrease their appetite, and lose a lot of weight, look better, and especially in a short period of time, because as we know, things are always moving in the entertainment industry.
Yeah. Having some friends in that industry, they say the buffet table is to die for. It's an amazing spread, and a lot of people that are on set say it's really hard to resist that kind of stuff, right?
Yes.
So the chocolate donuts, the powdered donuts, all the sugary, delicious things that are available to you, and it just kind of makes it want it a little less, right?
Yes, exactly. Yeah. Decreases that significantly decreases the craving. One of the things that they actually found these medications do is they affect your brain and your reward system in a way that your cravings decrease. For example, people who were smokers, they've been able to quit with Ozempic. People who were addicted to other substances have been treated with this medication. So it decreases your craving for pretty much any of these things.
Wow, that's amazing. That's incredible. Okay, let's talk a little bit about the side effects, because that's another question. I've been on tirzepatide before, and that was my number one question is, how is this going to affect me if it wasn't really intended for me, right? If it started off for diabetic patients, what are the risks, or what happens if I take it? And I'm not diabetic, right? So
Right.
What are some of those side effects?
Yeah, so that's a good question. Now, if you are not overweight, if you have normal weight and you start taking it, obviously that becomes like you're starving, kind of like being anorexic, which means you're malnourished. You're not getting enough nutrients to support your bone, your muscle, your skin, and then you're going to have skin problems, hair loss, osteoporosis, muscle loss, weakness. and also even wound healing problem. For example, you get a cut, it's going to take a lot longer to heal because you're not getting all those nutrients that you need to heal properly. If you are overweight, then yes, you definitely need to eat less, especially if you're having trouble controlling your appetite. But also, if you start these very quickly, if you start at a very high dose where your body is not used to them, you can get severe nausea, really bad vomiting, really bad stomach pain, and all of those just make your life really miserable.
Yeah, that's so true. That happened to me. I think I started off on a very high dosage, but again, we're really sometimes the guinea pigs in the industry kind of figuring this stuff out. And it was very early on, and I had a lot of hair loss, and so that has happened. But again, why it's so important to be under the care of a good doctor who knows this, right?
Yeah.
And I've also had that experience with friends who are like, I took a really high dosage at first, and I was throwing up all night.
Yes.
So everybody's different, and it's just important to not put the pedal to the metal, so to speak, right? And take it slow and easy. And I always tell people it's a long game. Yes, exactly.
It's not a quick fix where you wake up overnight and all of a sudden you lose 50 pounds. Just like anything else, it takes time, it takes patience. You can, and everything is good in moderation. So you shouldn't start them too quickly. I know people who started at a high dose, and just because of all that nausea and being miserable, they stopped taking it. What's the point of that?
Yeah. And are there long-term side effects with it?
So let's say you take it appropriately, you take it at the appropriate dose under care of a doctor who knows what they're doing. Long-term side effects are minimal for the most part. If you're not getting your macronutrients, such as your vitamins, then you can have vitamin deficiency. So you have to make sure you take multivitamins while you're taking these, especially if your food doesn't contain a lot of those macronutrients that are required.
Yeah.
Ever wish you could redesign your look even just a little? Meet board-certified plastic surgeon Dr. Joshua Jacobson, the architect of beauty. His expertise transforms your vision into reality. Whether you're dreaming of a subtle enhancement or a dramatic change, Dr. Joshua Jacobson can meticulously blueprint your ideal self. Don't wait, contact us today at 424-465-3800. That's 424-465-3800.
Another thing that could happen, another side effect of it is some muscle loss. Just because these medications put you in sort of like a starvation mode. They take you to a place where your body just feels like, okay, it needs to starve, it needs to not take so much in. So, and when we're in that state, we start to break down muscle to use it as energy, because we don't need muscle when we're starving. So, and in that case, you can get more frail, you can get weaker, you're not going to be able to be as active. What happens is, if you stop taking them, you're going to gain the weight back. And unfortunately, study after study has shown that if you stop taking these medications, even if you wean off of them, as if you're off of them completely, you're going to gain most of that weight back. And what happens is, when you're taking them, you lose a lot of fat and you lose some muscle. But when you gain that weight back, it's all fat. So that muscle that you lost during that weight loss stays lost, which is very bad. And that's why when you're taking these medications, you need to do so that's why when you're taking these medications, you have to do exercises, very regular exercises, and also take a lot of proteins.
Yeah, that makes sense. Absolutely.
Resistance exercise is very, very important.
Are you ready to achieve the body you've always dreamed of? Look no further than board-certified plastic surgeon Dr. Joshua Jacobson. Dr. Joshua Jacobson offers a range of surgical procedures to help you look and feel your best. From breast augmentation to tummy tucks, our skilled team will work with you to create a personalized treatment plan designed to meet your individual needs and goals. Let us help you achieve the confidence and beauty you deserve. Don't wait. Contact us today at 424-465-3800. That's 424-465-3800.
So can you be on it for a lifetime? Is that something that
So
People
that's
do?
yes. So that's what these are for. It's sort of because, you know, obesity is not like having an infection. You take antibiotics for 10 days and then it's gone. Obesity is a chronic long-term problem, kind of like diabetes, like high blood pressure. It's not something that you just fix it and then done. So that's why these are also lifelong problems. If you have high blood pressure, you're not going to just take medications, your blood pressure comes down, and then you're like, okay, I'm done. It's chronic. Same thing with these. You're going to need to take them lifelong. And that means lifelong you have to maintain exercise and also a high protein diet.
Yeah, okay. So do you recommend Ozempic?
If you are struggling with having if you're struggling with obesity and your BMI is over 30 or 35 and you're having comorbidities, yes, I think this is a very beneficial drug because it decreases your risk for all kinds of medical problems.
Yeah, that's amazing. Okay. And then what are the differences between the different semaglutide options, right? Like in the beginning when I first started, I did tirzepatide and I was so confused between Ozempic, Mounjaro, tirzepatide. What does it mean? And what are the differences?
Yeah, sure. So there's the brand name and then the generic name, right? Which means basically just the common name versus the scientific name. So the brand name, Ozempic, Wegovy, Mounjaro. Now the generic name, which is basically the name of the compound, Ozempic is semaglutide. Wegovy, that is the same thing, just a different dosing. And Mounjaro is tirzepatide. So essentially, we're just talking about semaglutide versus tirzepatide. So those are the two major categories. Semaglutide works by slowing your stomach emptying. Same with tirzepatide, but that also decreases your glucagon production and increases your insulin production. Tirzepatide has been way more effective than semaglutide. It's way stronger than semaglutide.
I've heard that. Yeah.
Yes.
Yeah.
So people who take semaglutide, they end up losing somewhere between 5 to 10% of their weight, or maybe at most 15%. Whereas with tirzepatide, Mounjaro, they end up losing up to 25%, 27% of the weight.
Oh, yeah. I've had friends tell me that I was lucky. I did tirzepatide the first time because they had been on Ozempic for like 8 to 9 months and didn't really have any progress. They weren't really moving the needle. But I had taken tirzepatide and within like 6 weeks, immediately like down 2 or 3 dress sizes. So
Yes.
it's pretty incredible.
Yes, that's
Yeah.
incredible. Yes, exactly. It's much more powerful. Yes.
Yeah. All right.
Ever wish you could redesign your look even just a little? Meet board-certified plastic surgeon Dr. Joshua Jacobson, the architect of beauty. His expertise transforms your vision into reality. Whether you're dreaming of a subtle enhancement or a dramatic change, Dr. Joshua Jacobson can meticulously blueprint your ideal self. Don't wait, contact us today at 424-465-3800. That's 424-465-3800.
So I have a question for you, actually. So one of the most confusing things is the dosages. So when me and my friends started taking it, we were all on different things. I'm on tirzepatide. My other friend was on Ozempic. Another friend was on, what's the other one?
Well, there is
Was it Mounjaro?
Mounjaro and Wegovy.
Yeah. So I'm like, okay, I'm on 8.5, and they're like, oh, I'm on 2.5. And so there's always a lot of confusion around the dosages, and we'd be sending each other pictures of like our our injection needle to be like, is this the right amount? And I'm like, I don't know. Check with your doctor.
Yeah.
Right. But I guess the question is what do you start off on? Like what units, how many units do you start off on, and why?
Ozempic and Mounjaro, they're two different compounds, which means they're going to have two completely different dosings.
Okay.
So with Mounjaro, a lot of times the initial dose is about 2.4 milligrams per week.
Okay.
And that's usually what's recommended.
Are you ready to achieve the body you've always dreamed of? Look no further than board-certified plastic surgeon Dr. Joshua Jacobson. Dr. Joshua Jacobson offers a range of surgical procedures to help you look and feel your best. From breast augmentation to tummy tucks, our skilled team will work with you to create a personalized treatment plan designed to meet your individual needs and goals. Let us help you achieve the confidence and beauty you deserve. Don't wait. Contact us today at 424-465-3800. That's 424-465-3800.
So that's Mounjaro. With Ozempic, usually you start at around 0.25 milligram and then you slowly build up. Same thing with Mounjaro. You start at 2.4 milligram and you slowly build up. But because those are two different completely different medications, the number of milligrams is going to be different.
Yeah, that makes sense. Okay. I have another question.
Mm-hmm.
So after taking something like Ozempic or tirzepatide or something like that, right? What is the after effects? Like, do people typically come in for plastic surgery? Do they need procedures after that? What are some of the after effects that people deal with after having taken a weight loss medication?
So that's a very good question. So when you gain weight, your skin stretches, right? And then when you lose that weight, sometimes some of that skin contracts, retracts back, but not all of it. So now we're seeing a lot of patients who've been taking these medications coming in with a lot of loose hanging skin, and they want that skin removed. Then they said, I thought I would look good when I would lose all this weight, but no one told me I would have all this loose skin.
Right.
So it's actually helped qualify more patients for plastic surgery, because before they were so overweight that surgery was dangerous for them. It wasn't safe.
Right.
Now that we can have them get surgery, but it's going to be more of like skin removal. We usually do a little bit of liposuction at the same time also, because liposuction, as we talked about in other episodes, is not a weight loss surgery. It's more of a sculpting surgery. I always like to do a little bit of liposuction with most surgeries,
right,
just to sculpt things.
Yeah.
Ever wish you could redesign your look even just a little? Meet board-certified plastic surgeon Dr. Joshua Jacobson, the architect of beauty. His expertise transforms your vision into reality. Whether you're dreaming of a subtle enhancement or a dramatic change, Dr. Joshua Jacobson can meticulously blueprint your ideal self. Don't wait. Contact us today at 424-465-3800. That's 424-465-3800.
So yes, we have seen an uptick in plastic surgery. Obviously, overall, the amount of liposuction that we've been doing has decreased because they lose a lot of that fat with these medications. But overall, yes. So that's usually the biggest change. Also, since if you have all this loose skin, that happens everywhere in your body. Your belly can have extra skin, so that's a tummy tuck. Your breast can get saggier, that's a breast lift. Your face can have sagginess and extra skin, so that's a facelift.
Yeah, that makes sense. Yeah, I find it really fascinating that some of our patients, after having like a tummy tuck, right, will say how they don't feel very full, and they're like, I cannot eat as much as I used to. And it's like a natural Ozempic.
Yes, exactly.
Right? Yeah.
And I always tell them, because during tummy tuck, we sew the muscles back together, the abdominal muscles, and that pushes on their stomach.
Right.
So they feel full much quicker. They eat a lot less, and they end up losing a lot of weight afterwards.
How much weight do people typically lose with that?
So they lose at least 10, 12 pounds. That's the least I've seen. I've seen up to 40 pounds.
Wow.
Yeah, like
That's a lot.
Yeah, because a lot of times they start to feel better about themselves, and they start to see that if I eat better, I can actually see the effect. Because before that, if they ate better and they lost weight, they would still have loose skin. So it was kind of discouraging. But now they're more motivated and they lose weight and they're much healthier than before.
Yeah, that's amazing.
Are you ready to achieve the body you've always dreamed of? Look no further than board-certified plastic surgeon Dr. Joshua Jacobson. Dr. Joshua Jacobson offers a range of surgical procedures to help you look and feel your best. From breast augmentation to tummy tucks, our skilled team will work with you to create a personalized treatment plan designed to meet your individual needs and goals. Let us help you achieve the confidence and beauty you deserve. Don't wait. Contact us today at 424 424-465-3800. That's 424-465-3800.
We also get people too, or patients that will say, when can I get back on it, right?
Yes.
After having had a surgery.
Yes. So that's a good question. Now, if you're taking Ozempic or Mounjaro, any of these medications, it's very important to stop them a week or two before your surgery, because if you take it all the way up to your surgery, you're gonna have a slow emptying of your stomach, and you can aspirate and you can vomit during anesthesia, during surgery, which is very dangerous. So make sure you stop them a week or two before surgery. And then usually I tell them they can start a week or two after surgery.
Okay.
But it's very important to make sure you're not starving yourself after surgery, because that's when your body is in a hypermetabolic state. It needs a lot of macronutrients, a lot of micronutrients to heal all those incisions, for your healing response. So that's why I tell them to start it maybe a week or two after surgery.
Yeah, that makes sense. Yeah. And you want to do the safest option, right? It's so important to listen to your doctor, and that medication will be there when your surgery is done. So
yes.
Yeah.
Yes, exactly. And it's also very important. So we get patients who say, well, I want to wait till I lose this much weight, or I don't know if I want to come in for consultation. But I think it's always best to come in for your consultations early, because we can tell you, okay, this is the amount of weight that you should lose. You should lose it before surgery or after surgery. We can time all of these.
Yeah.
It's always best to come in earlier, to have a plan, to have a good plan. It never hurts. And you can always call our office and talk to Heather, and she can give you guidance and make you a consultation. Our phone number is 424-465-3800. That's 424-465-3800. And when you come in, we'll tell you, okay, you need to lose more weight, or no, this is a good weight for you. You shouldn't lose more. Or let's say come back in 3 months, or talk to your doctor to switch you to other medications. Because sometimes people are like, oh, I've been on Ozempic for a year and a half, and I'm not losing any more weight. What should I do? Is it time to do surgery? And their BMI is still high, and we can't do surgery safely. So we tell them, talk to your doctor to maybe switch you to Mounjaro, which is usually stronger than Ozempic. It's always best to have your consultation early.
Ever wish you could redesign your look even just a little? Meet board-certified plastic surgeon Dr. Joshua Jacobson, the architect of beauty. His expertise transforms your vision into reality. Whether you're dreaming of a subtle enhancement or a dramatic change, Dr. Joshua Jacobson can meticulously blueprint your ideal self. Don't wait, contact us today at 424-465-3800. That's 424-465-3800.
Yeah, that is the number one question I get when people call in is, do I need to lose the weight first? And how long does that take? And it's really such an independent journey, right?
Yes.
That people are on. Yeah.
Yes, very different person to person. And it's kind of like we're your trainer. We'll tell you what to focus on at each point and when you reach your goal.
Right, absolutely. Thank you, Dr. Jacobson. That's super informative.
Are you ready to achieve the body you've always dreamed of? Look no further than board-certified plastic surgeon Dr. Joshua Jacobson. Dr. Joshua Jacobson offers a range of surgical procedures to help you look and feel your best. From breast augmentation to tummy tucks, our skilled team will work with you to create a personalized treatment plan designed to meet your individual needs and goals. Let us help you achieve the confidence and beauty you deserve. Don't wait. Contact us today at 424-465-3800. That's 424-465-3800.
Wow, this went by so quickly. Well, that concludes our time together this week. Thank you for tuning in, and I hope you all have enjoyed this show today. Make sure to tune in every Sunday at 7:30 a.m. on Go Country 105 FM to learn everything you need to know about plastic surgery, whether you've had it done or you're considering having a procedure in the future. We have many more exciting topics we're going to be covering on the air. And as always, if you have any questions or if you want to book a consultation, give us a call at 424-465-3800. That's 424-465-3800. Make sure to follow us on Instagram at Josh Jacobson MD. See you next time, same place. I'm Dr. Joshua Jacobson, your beauty architect. Actually, my mom is a hairstylist, and she does talk about that. It's kind of goes along with the appearances, and so I talked to her about hairstyles and hair colors, and she's told me about that you can't suddenly go from one extreme color to another.
Right, absolutely. It's a good hairstylist.
Good. I'll tell my mom.
Ever wish you could redesign your look even just a little? Meet board-certified plastic surgeon Dr. Joshua Jacobson, the architect of beauty. His expertise transforms your vision into reality. Whether you're dreaming of a subtle enhancement or a dramatic change, Dr. Joshua Jacobson can meticulously blueprint your ideal self. Don't wait, contact us today at 424-465-3800. That's 424-465-3800.
So our second one, myth or fact, advances in technology have made many procedures safer and recovery times shorter.
Yes, absolutely. It used to be that if you were getting a tummy tuck, you had to stay in the hospital overnight and the next day. That's not the case anymore. We always send our patients home, and we want them to walk from that first night. And a lot of things that have gotten safer are, number one, anesthesia. That has gotten so much safer in the past 20-30 years, and that's because we've added different types of monitors so they can pick up different physiological changes, and that way the anesthesiologist can respond and adjust things so that it doesn't go to the wrong it doesn't go in the wrong direction. So that's one. The other is the medications that we use during anesthesia have gotten so much safer, so much better, and a lot less side effects. That's number two. So, and number three, the surgeries have gotten a lot safer just because we've found out and we've figured out what are some surgeries that have more complications, so we stay away from them, or how to avoid those complications. For example, a case that comes up a lot is BBL, Brazilian butt lift, which is basically transferring fat to the buttocks and hips to give more volume and improve the shape. In the beginning, there were a lot of deaths because of fat getting into these large blood vessels and going to their hearts and stopping their heart.
Yep.
And we realized that that happens when we inject fat inside the muscle, inside the gluteal muscles, because there are a lot of big blood vessels there. So now we do not inject fat in the muscle. We inject it above the muscle, under the skin. And if you do that, you're 100% safe. So that's why a lot of these procedures have gone so much safer. And personally, I am very, very cautious, very, very worried about patients' health, patients' well-being, because at the end of the day, it's an elective surgery. It's cosmetic, so you don't want any bad complications to happen. That's why if something is not safe, I either tell them I'm not gonna do it, or I have to break it up, or you have to lose weight, or you have to change something. You have to see your doctor to adjust your medications. And obviously, I've lost clients because of that, but that doesn't matter to me, because all I care about is not to harm anyone.
Right. Safety first.
Yes,
That's an
absolutely.
absolute priority. Yeah, fantastic.
Absolutely.
Well, that's good. Yeah, because I think the biggest fear that we get from a lot of people that, ask more information or just have general questions is the anesthesia part of it. And they don't really know what to ask, or they just have that fear, and they call in and they say, hey, I really want to do this, but I've never had a surgery before in my life. What's it like going under? What's the likelihood that something would happen? And so it's really important to be educated and to have a board certified plastic surgeon who is skilled in this area, right?
Yes.
So yeah, that's a big concern.
Yes, exactly. And you are right that a lot of patients have worries about anesthesia. Now, fortunately, in the United States, there are so many regulations, and anesthesia has become so safe that they actually say you are more likely to get hit by a car and something really bad happen to you than actually having a really bad complication from anesthesia.
Oh, wow. I didn't know that.
Yeah.
Yeah, that makes sense. Very, very cool. Well, thank you. That's very, very helpful, and I think that would help a lot of people to lessen that anxiety, behind some of those thoughts.
Yeah, and what you have to make sure is, one, your surgeon is board certified by the American Board of Plastic Surgery. That is the only board that is legitimate for plastic surgery. Other boards are not other boards are not accepted in this field. So only American Board of Plastic Surgery is accepted. That's one. The other is you want the surgery center to be accredited by a national accreditation organization. There are different ones, Quad ASF, AHS. So always ask your surgeon if the surgical facility is certified or not.
Yeah. Actually, that's like the number one question I get is what's the difference between a plastic surgeon and a cosmetic surgeon? There's a lot of confusion out there about the two, and there's a very big difference, isn't there?
Yes, there is. So any doctor can call themselves a cosmetic surgeon. The medical degree that we get, it says physician and surgeon. So you could call yourself a cosmetic surgeon even if you're an OB-GYN, even pediatricians. Pediatricians do liposuction and
so you could be a pediatrician or a gynecologist or like a dentist and still do something like liposuction.
Yes.
Wow.
Yes.
I don't think a lot of people know that.
And so unfortunately, they call themselves cosmetic surgeon. That's legal to call yourself that,
right,
but it's very misleading because they don't have the right training. And, there have been instances of, actually recently, a few months ago, a pediatrician was doing liposuction on a patient, and unfortunately, the patient died during the surgery.
Ooh.
Yeah. However, you can only call yourself a plastic surgeon if you've had the plastic surgery training, and that's part of that plastic surgery training is reconstructive, aesthetic, cosmetic, all of that. So it's very important for you to ask your surgeon if they are a plastic surgeon or just a cosmetic surgeon, and if they are certified by the American Board of Plastic Surgery.
That's amazing. I did not know that.
And a lot of times when patients call our office and ask, and we kind of inquire, when we ask them, they say, well, I got a really cheap deal down in San Diego, and we looked up the person, and it was a dermatologist that was going to do lots of liposuction for very cheap. And we always send them this link that they can check and see if the person is certified by the American Board of Plastic Surgery. If you guys want to check that and you want to talk to Heather, she can direct you to that resource. You can call our office, 424-465-3800. That's 424-465-3800.
Yeah, absolutely. I'd love to answer some of these questions, and please give us a call.
Yeah, give her a call. She's not going to charge you.
Conversations are always fun and free.
Are you ready to achieve the body you've always dreamed of? Look no further than board-certified plastic surgeon Dr. Joshua Jacobson. Dr. Joshua Jacobson offers a range of surgical procedures to help you look and feel your best. From breast augmentation to tummy tucks, our skilled team will work with you to create a personalized treatment plan designed to meet your individual needs and goals. Let us help you achieve the confidence and beauty you deserve. Don't wait. Contact us today at 424-465-3800. That's 424-465-3800.
Okay, number 3, myth or fact? Plastic surgery is purely cosmetic and unnecessary.
So that's a myth. A lot of times there are surgeries that are reconstructive. For example, my mom had breast cancer. She had mastectomy. She had her breasts removed. And initially she didn't have reconstructions, and she always felt very self-conscious about herself after the surgery. She would always tell me, oh, I can't wear any of these clothes. Now we're going to this gathering. It's going to be awkward. And then when I went to medical school and I started learning about different surgeries, I saw a breast reconstruction, which is basically placing implants in the breasts of a woman who doesn't have breasts anymore to give them breasts again. And it was very simple surgery, very minimal complications, and I told her to do it, and she got breast reconstruction, and she was so happy. It really changed her. It gave her back that sense of womanhood. And that's one of those things where it's not vanity, it's really giving back a part that you lost. Kind of like if you lost a finger, yes, you can go without that finger, but you need that for function.
Right.
So that's something that a lot of people don't know. Another example is burns. People who've had burns and they're disfigured, we help them get back to a more normal shape. Another example is during a tummy tuck, we sew the abdominal muscles together because they get stretched during pregnancy and childbirth. And that basically weakens your core muscles, and it can cause a lot of back problems. As we know, if your core is weak, you're going to have back pain.
Right.
So when we sew those muscles back together, it strengthens your core. It makes it tighter, kind of like when you stretch a hammock, it gets more tight. And a lot of times patients say their back pain goes away. Speaking of back pain, a lot of women all of a sudden during puberty get very large breasts, and they weigh really heavily on their shoulders, on their back, and they get a lot of back pain. I actually had a patient who said she was having sciatic pain from her heavy breasts. Very young, very nice woman, 25 years old, and we did breast reduction on her and took out some of that extra weight, lifted the breast, and her sciatic pain was gone.
Wow.
So that's another
amazing.
example. Yeah.
Yeah, that's actually a really good point, because a lot of times when I talk to patients that, you know, especially in regards to the tummy tuck, it's that excess skin that's kind of hanging from, you know, having kids and having pregnancies in the past. On average, what would you say, you know, the amount of weight is that comes off when that excess skin is cut off from the tummy tuck procedure?
Yeah, so we actually weigh that extra tissue after surgery. Usually it's anywhere from 5 to 10, 12 pounds that comes off.
Wow, that's significant. And you know, that's interesting, because I always tell people, I'm like, when they're kind of on the fence about it, you know, I'm like, imagine you're carrying that 5 to 15 pounds around right now, right? Mm-hmm. And imagine if you walked around all day with a 5 to 15 pound weight in front of you for 24 hours. Mm-hmm. And then somebody finally comes to you and says, let me take that weight for you. Mm-hmm. How good that would feel, right? You'd feel so relieved. So exactly. You're right. A lot of patients have expressed that after having that excess skin removed, that they feel so much relief in their back pain, and it's life-changing.
Yes, it is. And again, plastic surgery is not all just cosmetic vanity. A lot of it is just to give you back the regular, normal body shape and form.
Right. Wow, that's amazing. Okay. All right, number 4. Myth or fact? Liposuction is a weight loss solution.
Myth.
How come?
So liposuction is a body sculpting procedure. It's to shape your body. It's not weight loss. Let's say if you're 50 pounds overweight, we're not going to be able to remove all that weight, because a lot of that is fat that's around your intestines, which is what we call visceral fat. That fat we cannot access, we cannot touch. No one can. If you touch it, if you try to take it out, you get huge complications. So also you have a lot of fat in between the muscles if you're overweight. So if your weight to height ratio, your BMI, is significantly high, you need to try other avenues of weight loss, which we'll talk about in one of our shows. And once you get to a more normal weight for your height, then we could do liposuction to sculpt your body, take out some extra fat here and there that's giving you the shape that you don't want. Right. And a lot of times these are areas of fat that are stubborn. They tend to be genetic. You know, people say everyone in my family has this little bit of belly fat, or everyone in my family has these big thighs, or fat in our chins. So that's what we really address during liposuction.
I see. Okay, yeah. I always like to use the analogy, like, your fat pads in your body are like puzzle pieces, right? And as you mature and as we age, those puzzle pieces start to shift and start to move to different areas, right?
Yes.
Which is why as we get older, we start to see that maybe transfer to our hips a little bit more, transfer, you know, you feel like you had a really nice bottom shape before, and now maybe just after having a few pregnancies, those pieces have kind of shifted, those fat pads have shifted. So
yes, exactly.
Very cool. Okay, number 5, myth or fact? Surgeons typically recommend waiting for specific periods between procedures to allow for proper healing.
Yes, that's very true, because, you know, I always tell patients, We're not IKEA. You don't come here and we just attach things and screw things and then you're done, you know?
Right.
50% of the work is what we do. 50% is what your body does, the healing response. And that healing response is very important. If you overburden the body with all that trauma, it's not going to be able to heal properly. So we need to give it some time, and that's why I don't do too many surgeries at once on one patient. So usually most procedures we like to wait about a month and a half in between at least.
Yeah.
And that's because that gives the body to that gives the body time to recover, decrease the risk of blood clots, and improve your body's healing ability.
Right.
Sometimes we may tell you need to wait longer, for example 3 months, 6 months, and that's because, let's say, there's scar tissue that's forming in an area and we want that to kind of finalize. For example, there are patients who need liposuction in their abdomen, an extensive amount of liposuction, and a tummy tuck. So what we tell them is we'll do some of that liposuction first, and then a few months later, about 5-6 months later, once the scar tissue has matured, then we do a tummy tuck.
I see. Right. That makes sense.
And that concludes our time together for this week. Thank you for tuning in, and I hope you all have enjoyed our Myth or Fact show today. Make sure you tune in every Sunday at 7:30 a.m. on Go Country 105 FM to learn everything you need to know about plastic surgery, whether you've had it done or you're considering having a procedure in the future. We have many more exciting topics we're going to be covering on air. As always, if you have any questions or if you want to book a consultation, give us a call at 424-465-3800. That's 424-465-3800. Make sure to follow us on Instagram at Josh Jacobson MD. See you next time, same place. I'm Dr. Joshua Jacobson, your beauty architect.